Well, good morning and welcome to my Sunday morning coffee with Dr. Childress. Mr. Pippin has decided to join me here today. So, today I want to be discussing the now adult survivors of childhood psychological abuse. And the primary theme for uh, this issue or this topic is abundant empathy and peer support. That's what we need to be doing with the now adult survivors of child psychological abuse. The One of the first things to realize about this is that my goal is to eliminate this category of people. Okay, that I don't want adult survivors of child abuse. I want to stop the child abuse so that we don't have adult survivors. The problem that we're currently facing is that we've had 40 years of failure from the forensic psychologists, from professional psychology, the clinical psychologists who abandoned you. And as a result, we have just thousands of now adult survivors of psychological child abuse by the forensic psychologists in collusion with the parents. And so this is just a really bad situation. And as we solve the pathology, it's not, we need to stop the active child abuse so we don't get more adult survivors of child abuse. And we need to go back and recover and heal the damage that was done. And there's two words with this. One is recovery and one is heal. Recovery of the attachment bond is one thing, and that's part of the healing process, but it's not the entirety of the healing process. There's another aspect to it. And we're professional psychology has abandoned the active child abuse victims. They've abandoned the adult survivors even more. And so, as part of the solution, there needs to be self reflective insight from professional psychology into their failure and into the bad things that professional psychology did to so many people. And as a remedy, we need to be doing more active outreach to resolve the issues. First, by identifying parents and children and families in the family courts as being a vulnerable population that warrants special professional protections. And then by also developing an understanding for and a treatment approach to healing the traumas of childhood custody conflict that were allowed to develop. Um, so, with that, uh, there's two primary issues with the now adult survivors of abuse. There's two categories of issue. One is from the parents, and the parents have a motivation to rebond with their children. The targeted chosen parent loves their child and wants to establish that healthy attachment bond even as an adult. And so they have a motivation to rebond with the child. The child, though, has a slightly different perspective. Their focus is on healing the damaged attachment system within themselves because that's going to affect their marriage, it's going to affect their own children, that's going to affect a lot of things about their happiness, depression, things like that. And so as the rebonding with the adult parent as an adult is part of a healing process, it is not the entirety of the healing process. And so the adult child or the adult survivor of child abuse has additional focus or additional agendas relative to this. So the question becomes for the professionals, who's the client, the parent or the child? When there's a difference in agendas between what the parent seeks to accomplish and what the child is seeking to accomplish, or the now adult survivor of child abuse is seeking to accomplish, where does the therapist go? Which client are they working for? Which best interests? And from my perspective, I'm staying with the parents. And I'll describe that a little bit later. I have a role, and everybody has a role, and so I'm going to remain within my role. The issue surrounding the now adult survivors of child abuse is the absence of empathy. Child abuse, the damage from child abuse is not from the physical act of the abuse. It's from the psychological act of betrayal. And that's Moore and Silver. And they did a wonderful study on this and found that the we recover relatively easy from the physical acts of abuse. It's the psychological betrayal of empathy, the absence of failure of empathy from the parent that is the cause of the damage. So the inner repair of the child is through the application of abundant empathy. Here's some quotes from Moore and Silver about their study, where they looked at the difference between people who were abused as children and those who had good outcomes and those who had bad outcomes, and what was the mediating factors. And it was parental empathy, or the failure of parental empathy was the one that determined outcome. And they did a multiple regression where they fed in each of the criteria, or each of the issues sequentially. And what they found was interesting. They found that the absence of empathy resulted in just as much damage as the child abuse did, that the two are one and the same thing. They're just flip sides of the same coin. You cannot abuse the child without an absence of empathy, and the absence of empathy results in the abuse of the child. So here's from Moore and Silver. The act of child abuse by parents is viewed in itself as an outgrowth of parental failure of empathy and a narcissistic stance towards one's own children. Deficient of empathic responsiveness, prevents such self-centered parents from comprehending the impact of their acts, and in combination with their fragility and need for self-stabilization, predisposes them to exploit children in this way. Only insofar as parents fail in their capacity for empathic attunement and responsiveness can they objectify their children, consider them narcissistic extensions of themselves, and abuse them. It is the parents' view of their children as vehicles for satisfaction of their own needs, accompanied by the simultaneously disregard for those of the child, that makes the victimization possible. So, in the treatment of the child abuse and in the restoration of the parent-child attachment bond in adulthood, the question becomes whose needs are being met, those of the child or those of the parent. And it is vitally important that we meet the needs of the child, or the now adult child, because that's the pathology, is we've been asking the child to meet the needs of the adult, and that's the psychological child abuse. So we need to reverse that relative to the child. However, there's a second client involved in this. There's a second client involved in this, and that's the parent. And the parent has their own motivation to rebond with the child, which is consistent with the healing of the child. But the parent is coming with their own motivation, their own agenda to rebond. And are we meeting the parent's need to rebond, or are we meeting the child's need to heal, or the now adult child's need to heal? And so that's a important distinction relative to the therapy people. And that's why, as I'm making that distinction, I'm staying with the parents. That's how I came into this situation. Let me explain why. When I arrived here, I have duty to protect obligations. And I'm not a child abuse. I see the child abuse going on in the family courts, and so I activate into my duty to protect the child. The problem I faced was that I couldn't reach the child. because the forensic psychologists were enclosing them away from rescue. And so I had to get through the psychology people to get to the abused child to rescue them. And normally in a situation of child abuse, I would just refer into the local area professionals, get an assessment. I couldn't do that in this case because the local psychologists were participating in the child abuse. Holy cow. So I took instead, now my client in the family is always the child, because if I solve things for the child, I make the parent happy and everything's good. But in this case, I took the parents on as my client. And the treatment for traumatic grief. So that was my marching orders, is to treat and resolve the traumatic grief in the parents. How do we do that? By restoring the attachment bond with the child. How do we do that? By getting a proper assessment of the pathology, and then it's a child abuse, and then we can protect the child. So by empowering the parent to protect the child, I protect the child. And so my client is the parent in solving the parent's problems, and in that way I can protect the child in the family courts. And my focus is on protecting the child in the family courts, stopping the active child abuse and stopping the active spousal abuse. Now, when we move to the recovering the now adult children, or healing the now adult children, that shifts perspective. And so there's kind of two types of therapists that can emerge off of that. One's representing the recovery of the relationship, the other's representing the healing of the child. I can see the recovery therapist sort of moving into both roles, but I still think there's an important role for the mental health professional or the peer support paraprofessional to be focused solely on the healing of the child and that agenda, those needs, and not the needs of the parent to rebond with the child. The child's need to rebond with the parent. That's a different thing, but the parent needs to, that's a different agenda, and we need to recognize that agenda. I'll carry that agenda, and I'll represent for that voice, and we can work things out when we get there. But it's important to understand that the focus in this, he needs to focus on the child, and for the now adult children in the recovery, not the needs of the parent for recovery. However, going into this domain, I will be representing for the parents and the parents' agenda of wanting to rebond and wanting to heal the trauma of their spousal abuse, of their loss of their child. Holy cow, they love their child, all sorts of stuff like that. And that will be consistent with the healing of the child going forward. So, parents and children provide what's called a holding environment, or parents and therapists provide a holding environment for the child's negative emotions, or for the client's negative emotions. And anytime we're asking the child to understand us, empathy's flowing in the wrong direction. And so that's just a rule of thumb. If you find yourself asking the child to understand your perspective as a parent, or as a therapist, if you're asking your client to understand your perspective, empathy's flowing in the wrong direction. Now, let me talk a little bit about breach and repair sequence, because this is important. I'll get to this more later going forward, because it's important, the breach and repair sequence. But one of the features as a therapist, let me describe a breach and repair sequence as a therapist when we make a child abuse diagnosis against a parent. So let's say I've got a client in my clinic, and we're working with the parent and the child, trying to do things. And there's something comes up where the parent got a little out of control, a little angry, a little something, and I'm going to make a child abuse report to Department of Children's Services. And that's going to cause a breach with the parent, because now here I've been working with the parent in therapy, trying to help them, and they're trying to work on their parenting and things. And now I'm going to report them to Child Protective Services. So they feel really betrayed by me. And so they'll come in, the abusive parent will come in and be angry at me for how dare you say I'm abusing my child because, I'm working with you and I'm trying to do these things. And if I respond defensively and try to convince them, well, this is the issue and I had to do that because I'm a mandated reporter and all these things, I'm stuffing down their perspective. I'm saying that they're upset because of the betrayal, the failure of empathy, an empathic failure. That's what always causes a breach. And so I wasn't empathic with their struggles. And I just objectified them and saw them as an abusive parent and I'm going to take their child away and all that kind of stuff. And so they're really hurt by me. And yet I'm asking them to understand my situation and forgive me for making the complaint or the report. No. That's going to re-traumatize the client, re-traumatize the person. What we do when empathic failure creates the breach, we apply empathy to repair the breach. And so that's the first thing we do as a therapist. So when that parent comes in really angry at me about making the justified report and required mandatory report to CPS, I respond non-defensively. And that's the first thing. Respond non-defensively. Put that the little post-it note in your brain. Respond non-defensively to anger. When somebody's angry with you, stop. Don't defend. Apply empathy. Tell me more about that. That would be, I can understand why you're upset. Tell me more about that. Yeah, so here we've been working together and I betrayed you. Or you feel I betrayed you because now I'm saying you're abusing your child and it doesn't feel like I understand your motivations. Tell me more about that. Okay. So I elicit and I apply empathy to them. That heals the trauma. The defensiveness, asking them to understand me, will re-traumatize them. My understanding them, my holding their anger, not responding to their anger, but responding to their pain underneath the anger, helps them process that pain underneath the anger. So that's what we do in the repair of things. We act, and that's true for the parent with the child. That's true for the therapist with the client. The more mature nervous system, the parent or the therapist, acts as a holding environment for the child's negative affect, negative emotions. And we don't respond to those. We just hold them and process them. And we respond to the underneath, the hurt, the pain. We respond with empathy for the child. So, abundant empathy is the treatment plan for the now adult survivors of psychological child abuse. However, there are barriers to providing that to them. First, we have one parent who's a problematic parent incapable of empathy. That's the allied narcissistic borderline dark parent. And then we have a second parent who's entirely destabilized by the being spousally abused and is anxious and just kind of emotional mess because they're being actively abused and they're caught in their own trauma. Then we have the issue of the therapists who are absolutely incompetent, so there's no empathy available from the mental health system. And that leaves us with peer support, which is a great source of empathy. But the problem is the peer support has potentially no insight. So we have in a peer support approach, which is what I'm going to be recommending going forward, is you're going to have people entering that community with limited insight or initial insights, some discomfort, realizing some things are a mess, kind of wanting to figure kind of things out because it's turbulent inside and they want to solve it. So they'll come in with some initial insights, but less developed. Then you will have more advanced recovery, more advanced people who are further along the path of healing the psychological child abuse, who will have a richer set of insights that will help guide the unfolding of increased insight within the now adult survivors of child abuse. Now, the parent, the targeted chosen parent, is going to be highly motivated to get the insight that the child realizes that the other parent was abusive and that they're the wonderful parent and forgive them and make a. But that's the agenda of the parent. Okay, that's not the agenda necessarily of the child. The child's in a difficult situation. They lost one parent because of the pathology and developing insight that the other parent was psychologically abusive to them as a child and kind of didn't take care of them, their needs. They'll lose the other parent. So now they become essentially an orphan. They grieve the loss of one parent during childhood, and now they grieve the loss of the other parent during adulthood, and they can't recover with their now adult or their adult parent because they're no longer children. They're now adults. So they've lost it no matter what. And now they feel really guilty because they didn't stand up to the abusive parent. And so the guilt goes off the charts and their grief is off the charts and everything's a mess. So the agenda of the parents of the now adult children is interesting. But I think we need to be focused on what the healing process for the now adult survivor of psychological abuse. And that will very, very likely involve a repair of the attachment bond, affectionate attachment bond with their parent, with a formerly rejected parent. But I think the orientation needs to kind of be more appropriate or fuller, richer in our understanding. So that's kind of the current situation on getting the empathy to this client group. So peer support. This is the best source of empathy. There's nobody who understands a situation better than someone who's gone through it. And specifically in this situation too, because it's such an unusual type of pathology, really the understanding for the child's experience can really only come from having lived the child's experience. But the patterns are the same for the pathology. So the patterns are the same for the damage. So there will be a consistency of the type of emotional damage with all the now adult survivors because of the consistency of the pathology that created it. So, and so the insight on peer support would come from the more advanced recovery people. And then also for the more advanced, as they continue to recover and continue to heal from damage, is that helping others is part of the healing process. So we see that with substance abuse or eating disorder or a lot of different things where helping others in recovery will help your own recovery, will help your own healing. So I'm a strong advocate for the peer support group, but I have to stay out of that because I'm a professional. I'm not a peer. So the peer support group kind of has to self-generate a little bit here. Agendas. Everybody around these children has an agenda to use the child to meet their own needs, wants, and desires. And I won't participate in that. Okay. So I won't participate in agenda motivated use of the children of abuse as their now adult voices. So from my perspective, I will remain focused on the parents and the recovery from the parents' perspective, facilitating the healing of their traumatic grief and loss and their love for the child and being able to reconnect and being able to provide that love to the child, knowing that getting love to anybody is a good thing. And so getting love to a now adult child from a parent is going to be a good thing for the child. And that way I'm clear in my role and clear in my boundaries relative to the needs of the now adult survivors. So my goal as a psychologist is to first acquire professional competence to stop the act of child abuse in the family courts, and then this foundational competence and empathy from the professional psychologist can be expanded to the need. So down the road, 10, 15 years, I'd like to see a professional level in working with the now adult survivors. However, there won't be any now adult survivors. But we need to get the competence first into the family courts and treating the pathology and stopping it. And then that competence that's there can then be expanded out to address anybody that got damaged from 40 years of failure. So with that, I'm going to head off to my the rest of my Sunday. Yeah, I'm reluctant to provide any input to the children that are caught in the middle or to the now adult survivors of child psychological abuse, because I'm worried that that's going to be rolled into the agenda of the parents who are seeking so desperately, because they love you so much. They're seeking to restore that attachment bond. And so I'm going to stay with that role and let you kind of self-form into your situation. I'm available as support. I'm kind of like an outside ally to the LGBT community. You know, I'm a straight guy, but I'm an ally. But the understanding of the issues in the LGBT community has to come from that community, from the African American community, Black community, from wherever needs to develop within the community. And I'm here as an outside professional resource on that. So with that, good luck, everybody, and we'll check in with you next week over Sunday coffee. Bye-bye.